Hi everyone, my name is Thang Lee and today I will talk about Enterobacter chloride bacteria. So as you see over here is the Enterobacter chloride image. They have a kind of really loose shape and then have a lot of peely show over here like appearance of them. Okay, so I will talk about Enterobacter chloride as is well-known opportunistic bacteria that's we found in intestinal tract of the human. And it could become nosocomial pathogen in patients with antibiotic therapies. So how it can happen? Before it, I will talk about what is Enterobacter chloride. Enterobacter chloride is basically a gram-negative bacterium that belong to Proteobacterium phylum and Enterobacteria care family. It had a root-shaped appearance and is anaerobic bacteria with four features that I found in the project module 1 is PLE, as you see over here, the PLE that help them to be adhesive. LPS over here, the peptidoglycan is really thin peptidoglycan in here because it's a gram-negative bacteria, and also secretion system in here. So where Enterobacter chloride can be found? As I said earlier, it can be found in healthy human. In healthy human, Enterobacter chloride is normal flora in human intestinal tract. As you see in this picture, they live really friendly to a lot of other bacteria. This one, the green one is the Enterobacter chloride, and other bacteria is the yellow, the orange, and so on. They also can live in insect or animal, and they can found on land and in the water, such as food, soy, seaweed. Come back from the human. In the normal one, they are kind of normal flora. However, when human is exposed to antibiotic therapies, like you see in this picture, a lot of antibiotic will kill a lot of other normal flora in intestinal tract. However, Enterobacter chloride will undergo mutation to resistant to antibiotic for over-selection and overgrowth their population. They then use endogenous translocation process to move out the intestinal tract. By first, they will cohesive to penetrating the mucus layer in here, as you see. And then they will invasion to the epithelial cell to bloodstream. And as you see in here, they stand in the bloodstream, they will move to yield serum resistance to survive and spread the disease and go to all the organ to spread the disease in here. So the infection and disease that's caused by Enterobacter chloride is when they move from the blood system from here, you see intestinal tract, they will move in the bloodstream that's called the bacteremia, like its bloodstream infection. It's also called intra-abdominal infection in here. They move out here. They call skin and soft tissue infection, also urinary tract infection in here. They also go to the heart lining in, of the heart and call the infection in here. The disease is called endocarditis infection. And finally, it can call osteomyelitis infection. Is a bone inflammation. Usually it's in the tooth or in the bone of the foot. So the virulent factor that the bacteria use to interact with human cell is first cohesive, second invasion, and finally serum resistant. About cohesive and invasion, they will use together to move out of intestinal tract by the use aerobactin to sharing iron in the iron poor environment. You see how the bacteria sharing iron. and they use monosensitive hemagglutinin to pass epithelial cell easier over here. Finally, when they are in the bloodstream and they are all in all other organs, they will resist to the host serum bacterial radioactivity in the intestinal tract to survive and spread the disease. It's all about Enterobacter chlore. Thank you for listening.